bony part and the muscular part. So I will try to finish the bony part and Dr. Ramzan will join for the muscular part. Okay? This is group A, B, wala mix, wala what?
A.
Only A?
Yes.
Okay. If anyone from B is still welcome, I have no problem. Up till he has no problem. Okay. Any question from the previous? Brachial plexus axilla. No mushkil? Understand? Remember the ulnar nerve? Okay. Clavicle and the scapula. Shoulder. Shoulder is this. What is this shoulder Arabic? Okay. What is the girdle? What is the meaning of girdle? Define. Define girdle.
Built.
Like a belt. Define it. Girdle. In anatomy, yes. In anatomy, we have the term girdle for the shoulder is attached to the thoracic wall. Okay? How? With two bones, clavicle and scapula. Maybe like a belt, if you say like. In Arabic translation, I don't know. But here, clavicle and scapula, these are called pectoral girdle or shoulder girdle. Okay? The two bones. This is the feature, objectives. So, let us describe the clavicle first. Where is the clavicle? Whenever you describe a bone, say there is an anatomical position of the bone. Before that, we should have our own anatomical position. And this is like this anatomical, with my hand like this. We suppose, whenever we read anatomy, we suppose that the body is lying in this anatomical position. How is this? Eyes in front, thoracic wall in front, hands, palms like in front, not like this on sides, not on back, like this, and foot at the standing place. This is called anatomical position. When I describe any bone, this is in the anatomical position. For example, the clavicle. Here is the clavicle bone. We can join later if you miss something. Here is the clavicle bone. Okay? So it's very difficult to find like this in the body or like this in the foot. One of the difficult bones. How? First, whenever you hold the bone in anatomical position and you will remember everything. For the clavicle, you must hold. See, this is a rectangular sort of structure and this is a flat structure. Okay? So this rectangular must be on the medial side. This is my medial side. The flat must go on the lateral side. But if I now put bone like this or like this, it fits both the areas. But then we have to see the surface. The upper surface is smooth, the lower surface has a depression for subclavius. And you remember it now. For subclavius. So make that depression down, flat end laterally, the quadrangular end medially, and you find the bone right or left. So whenever you hold a bone, think like hold in the anatomical position, and secondly, how is it from the right side or it's from the left side? Understanding with me? Say yes boldly. Yes. Okay. Where is the clavicle? This is the clavicle. How it is placed? See, from front it looks like this. On side or superior or inferior view like this. So, what is the medial end? This is the medial end or the sternal end because it's joined with the sternum here. Sternoclavicular joint. Here joined with acromion process of scapula. So acromioclavicular joint. Here, acromioclavicular joint. This is the medial end. This is the medial end. This is the medial or sternal end. This is the flat end. Like I told you here, the medial end rectangular coming with the sternum, the lateral end flat going towards the laterally scapula, acromial process making acromioclavicular joint, and try to remember this elevation or a groove facing inferior. This is how you know right and left. So this is my left clavicle.
But like this.
Give it to me. This is the story. Yes. Now here. Now see both the bones together. Good? See the sternal end towards the medial side, flat end towards the lateral side. It can be like this. But I must see the groove. Put the groove down. So now it is right side. Clear? Very tricky bone. So be very sure of the right or left clavicle.
But what about you can switch it like this?
Yes, switch it like this. Then this groove will go up. I need the groove down. Okay? So leave it with me. It will make you more confused now. Okay. Now clear? Again, clavicle is a flat bone like this. Second name is beauty bone. This is a flat bone with rectangular end here and a flat end laterally. Now I must be very careful. The rectangular end or quadrangular end is four-sided and it is making sternoclavicular joint, and the flat end is making acromioclavicular joint with the acromion process of scapula here. Like this. Good? Now, what are the joints? Here, sternoclavicular joint, acromioclavicular joint. Where is subclavius? Here, subclavius groove, subclavius muscle. See the subclavius groove. I will go one by one. Now, the clavicle is the only long bone which is lying horizontally. For example, the humerus is lying vertically in my anatomical position. It's vertical. All long bones in the world, they are vertical, except this is a long bone horizontal. Good? This is one beauty of this. Subcutaneous throughout. Yani you can feel the whole bone. Subcutaneous. First bone to start the ossification. So these are the features for, very good features for clavicle. Supports the shoulder for swinging movements. Swinging movements. Transmit the weight of the limb to the sternum. If I fall like this, the whole strength is going towards the sternum. And when I am standing, the whole weight of my limb is connected to sternum here and with the vertebral column with the help of scapula. So these two bones, clavicle and scapula, is combined known as shoulder girdle. Clear, Shubha? Features: lateral end, medial end, shaft. Lateral end, medial end, shaft. Khalas. Good? Easy. Lateral end, other name acromial end. Lateral end, other name acromial end. Flat above and downward. This is flat, this is flat. And facet of acromial process. If you feel there is a flat surface here for acromial, this. To make acromial, this is acromial process or acromioclavicular joint will be made like this here. This is scapula, this is clavicle. Break them out and put them together. Okay? The medial end, it's stronger, it's quadrangular, and it is also named as sternal end. Quadrangular in shape, articulates the clavicular notch of sternum to make the sternoclavicular joint. I told you earlier here, this is the sternum, here is the sternoclavicular joint. Here is the acromioclavicular joint. Clavicle has acromion fascia and acromion process is on the scapula, so acromioclavicular joint is here. Good? Understanding? If any mushkil, please raise the hand and stop the camera. Then I will give you some stories. The shaft. So here is the shaft. Here is the shaft. Good? Shaft. Flat from above downward, it's like flat. Then anterior border. See, concave forward, like this. The posterior border is like this. Yes, it's convex from the backward. Superior surface, inferior surface, subcutaneous, and here this elevation conoid tubercle. Conoid tubercle. Again, clavicle, two ends, acromial end, sternal end with a shaft. The acromial end laterally, the quadrangular end or sternal end medially, making sternoclavicular joint, making acromioclavicular joint. The shaft is smooth on superior and anterior with convex like this, concavity here. If you see the bone like this, it's slightly S-shaped. This is smooth surface, this is inferior surface with a groove and a conoid tubercle. Tubercle is an elevation. Clear now?
Okay.
Yeah,
What is the superior surface and the inferior surface?
good. Here is my clavicle. All this superior surface. All this inferior surface.
Same above and down.
Yes. Anterior border. Where is the border? The border is the sharp line anteriorly. The border is the sharp line posteriorly. So border. This is a border. This is a border. This is a surface. This is a surface. So think like margin, sharp margins like borders and flat areas like surfaces. Okay?
What is the conoid tubercle?
Yes. On this bone, can you just see this elevation? This is conoid. Okay? Here. Elevation on the bone, on the inferior surface. So, whenever you are deciding regarding right or left clavicle or anatomical position, you must remember this end, medial side, this end, lateral side, conoid tubercle and the groove facing downwards. Good? Shaft, medial 2/3. Now we divide the shaft in two parts. Medial 2/3, this one, and lateral 1/3, this one. Good? The medial 2/3 is rounded. If you feel the bone, it is very much rounded here. Okay? Anterior surface convex forward, like same I previously told you, this one. Anterior surface, you can even feel the clavicle. Anterior surface. Posterior surface, smooth. Superior surface, smooth, rough on the medial margin for sternomastoid muscle. And inferior surface has subclavian groove here. Subclavian groove. So, here, medial 2/3, smooth with some rough area for sternomastoid, rough area down for subclavius, convex and concave urula. See the muscle attached to the clavicle. Here are certain muscles attached to the clavicle. We will start from the medial end to make it easy. Here, sternomastoid. Here is the clavicle. This sternomastoid, so attached here. Sternomastoid. Pectoralis major muscle, maujood here. Attached to this margin, pectoralis major muscle, from like this. Then, origin of deltoid muscle. Where is deltoid muscle? Here is my deltoid muscle. So, the fibers, deltoid had three types of fibers: anterior fiber, middle and posterior or lateral fibers. So, anterior fibers are arising from this part of the clavicle and attached like this. So, from here, going back, and all of this is attached to this part of humerus, the deltoid tuberosity here. Here is the deltoid tuberosity. So deltoid muscle is attached. If we have all three together, this will be an easy thing. Yes, this is all three together. So here is the deltoid. From here, then whole of this process of scapula, acromion, and then the spine of the scapula. So deltoid is like this. Anterior fibers, lateral and posterior fibers. All of them, they come and join here, deltoid tuberosity of the humerus. On the inferior surface, we have very important subclavius muscle and coracoclavicular ligament for the stability of the joints. Scapula. This is scapula. This is scapula. Now, how to find right or left?
Spine.
Yes, from process spines, exactly. But before that, we must know anatomical position like this, like this, like this. The anatomical position is like this. How? This flat surface is in front. Subscapular surface or scapular surface. This spine is on the back, like this. Good? The spine is on the back. The spine divides the posterior surface in two parts. Supraspinous fossa, infraspinous fossa. Good? So, how to find right or left? Try to think of this glenoid cavity. This glenoid cavity. This is very superficial, sathi. With the head of humerus like this. Make the shoulder joint.
It's called glenoid.
Cavity. Glenoid. G-L-E. Glenoid cavity. I have the name. Glenoid cavity. Try to put the glenoid cavity on the lateral side. Put the spine on the back side. And you are through with the right or left. So, if I make it like this, the spine should go back. And glenoid cavity should face the lateral. So this is scapula from this side. Okay? So this is right scapula. If I have a left scapula, I will. Yes. See the two scapula now. Right wala left?
Left.
How right? Someone told here. No problem. Yes. Try to assess both of them. No problem. Take 1 minute. I am here for you to make you understand, not just to speak. See here. Glenoid cavity must be outside. Spine must be back. Fit here. Bring here to right side. Try to fit it here. No. Glenoid cavity must go here. Good? That is okay. Understanding? Now, you know the anatomical position of scapula? Scapula is a flat bone, okay? Posterior view of thoracic cage. See here. For the other one. Yes, Shiva? Now, understanding? The glenoid cavity should be on the lateral side. Lateral here, lateral here. The spine should be on the back, spine on the back. Here you are seeing the clavicle. Here it's not visible. The front view is like this. Here, if the thoracic cage is present, you are not able to see the whole surface. You are only able to see the glenoid cavity and the two processes. This and this. Acromion, coracoid. Acromion process, coracoid process. Scapula is a flat bone. Features: costal surface, dorsal surface. Where? Costal surface towards the rib. Dorsal surface, this one, with the spine. Superior angle, inferior angle, lateral angle. Superior angle, zavia. Superior angle. Inferior angle. Lateral angle is the glenoid cavity. Superior angle, inferior angle, lateral angle. Spine, acromion, coracoid. Spine, acromion, coracoid. Good? Again, two surfaces, front and back. Costal and dorsal. Costal, dorsal. Three angles: superior angle, inferior angle, lateral angle. Spine with acromion process, coracoid. Like this is coracoid. Coracoid. See here features. Superior angle, inferior angle, lateral angle. Costal surface. Dorsal surface with spine, acromion process, coracoid process. The spine divides the whole of this space into two parts, supraspinous fossa, infraspinous fossa. This is, yes, I finished all this. Borders. There are certain borders, very sharp, very nice borders. Superior border, this one. See here. Superior border. Lateral or medial?
Media.
Try to fit in the anatomical position and then find the border. So fit it here, make it like elevated, here medial border. Here, very thick, lateral border. Now, the border between this angle and this angle, superior border, border between superior and inferior angle, medial border, from inferior to glenoid, lateral border. Clear, Shiva? Yes, glenoid cavity, like this. Acromion process, coracoid process. All same areas. Except this notch is visible now here. Where is the notch? Here is the notch. Can you see this notch? Can you see this notch clearly now?
What's it called?
Notch. So scapular notch most of the time. So sometimes it's suprascapular, but don't is supra. Say scapular notch. Here, scapular notch. Scapular notch. Again, all the structures for you, now you even don't need the bones to see this. Right or left?
Right.
Yes. I am standing here, the scapula is on the back, glenoid cavity on the lateral side. The costal surface in front, so right scapula. See the parts. Name now, you. Superior,
Border.
angle. Angle. Border is this. Angle. What?
Inferior angle. Lateral.
What is on the lateral angle? Which cavity? Glenoid cavity, like this. To make the joint with the head of the humerus, shoulder joint. Okay. What process? Coracoid. What process? Acromion. What border? Superior. What border? What border? Very good. Again, the back, spine, acromion, coracoid, notch, superior border, superior angle, medial border, inferior angle, lateral border, glenoid cavity or lateral angle. Khalas. Clear? The whole of this infraspinous fossa. Infra, tahat. Below. The spine is infraspinous. Above the spine, supraspinous fossa. Fossa is a cavity or a depression sort of. So supraspinous fossa, infraspinous fossa. Good? Here are certain muscle attached. In some of the books, the new books say attachments. The old books say origin and insertions. Try to control it now for you to understand. When you have red areas, according to old books, this is origins. When you have blue areas, according to old books, this is insertions. Origin, for example, biceps arises from here, inserted here. Other book says proximal attachment is here, distal attachment is here. But the area is same. So, here in the infraspinous fossa, whole infraspinatus muscle, supraspinatus muscle, spine, deltoid and trapezius muscle. Here, below deltoid, above trapezius, this one, trapezius muscle. Here, three muscles. Levator scapulae on the superior angle, right from here. Supraspinatus muscle is this one. Rhomboid major, minor. Then two teres, major or minor. And here, on this side, two teres, and on this side, rhomboidus, major and minor. Where they are? Here. Rhomboidus and teres. Don't be worried about the location of these muscles and their functions, and we have a separate group. Dr. Ramzan will join us for the muscle. He will show you the muscles and again the attachments. So don't be worried. Our objective mainly here is to know the bony parts, that when he says this muscle attached to superior angle, you must know. So again, I will revise very quickly. This is how you find the scapula, right and left. This is the anatomical position. The costal surface, the dorsal surface, two processes, acromion, coracoid. Superior angle, inferior angle, lateral angle. Lateral angle has a cavity, glenoid cavity. Here, lateral border very thick, medial border thin, superior border, superior angle, inferior angle. Infraspinous fossa, supraspinous fossa. Spine of scapula with two lips, upper and lower. And here acromion process, here coracoid. Clear, Shiva? Here is the notch, scapular notch. This is the objective for other, but just to show you the movements, I will revise, he will revise the movements to make you more understandable. Medial rotation, it can be done like this, but I am not sure it's really the head of humerus is moving or not. So make the elbow flexed and then you will find a very good rotation medial, very good rotation left. This rotation at shoulder, okay, rotation at shoulder. Abduction, adduction, abduction, adduction. Overhead abduction, overhead. And combination of movements is circumduction. In previous lecture I told you flexion, extension, abduction, adduction, medial rotation, lateral rotation and combination circumduction, like this or like this. Okay? Same, I told you flexion, extension, abduction and rotations. Elevation of scapula, depression of scapula, down. Adduction, when both the scapulas are moving inside, like this. And abduction or protraction, when both the scapula are moving on opposite side. This is upward rotation, this is downward. This is the two bones with, see the glenoid cavity with head of the humerus. But the head is bigger than the glenoid cavity. And that is the reason the shoulder is not a very stable joint. The nature has provided along with the glenoid cavity a very big cartilage, thick, to make it deep, amoeba-like, because it is very sathi, superficial sort of. This is the posterior view. See the three bones, clavicle, half of it, with acromioclavicular joint, here, spine of the scapula, here, shoulder joint with head of the humerus, glenoid cavity. Both of them together, right and left. I finish here, rather I stop here. Dr. Ramzan will join in 5 minutes. I will inform him, inshallah. You stay here, relax, and if there is any question, ala uyuni.